Okay, next up for non-clinical careers is what I'm just going to title government jobs. So I used to work in the VA healthcare system for about 11 years. And of course, I did have a clinical job. But there are some non-clinical jobs in the VA healthcare system. Not that many, but that is a place to look. So the key to getting a government job is that you have to apply through USA Jobs. So at the end of this video, I'm going to put a little screenshot of that link, but you got to go to USA Jobs. That's where all of the jobs are. It's a very generic looking website, but you have to apply through there first. So if you're applying through a job in there, have like this thing called GS system, and that kind of ranks. Most physicians are going to be, I think, at least a GS 13, 14, or 15, and that is basically kind of will determine like how much pay you have. It could determine like if you have a supervisory role or not. So if you see like GS, if you're a physician, just apply for all of them up to the highest one, because if you're a physician, you probably qualify for the highest one anyway, particularly if you've had any supervisory experience. So don't let that deter you in any way. The key to navigating USA Jobs, okay, is if you're looking for a non-clinical job, is to filter by not like physician, but like medical officer, medical director, like use those terms. And then also, if you know the agency, that will help you, because if you just put in physician, it's going to bring up the place that has the most jobs, and that is the Veterans Administration. So it's going to bring up like all these clinical jobs, and you'll really have to search for the non-clinical positions that are there. So try searching by medical officer, medical director, and the agency. So the name of some agencies are going to be things like the FDA, the Food and Drug Administration, Center for Medicare and Medicaid Services, the Department of Health and Human Services. That's what the CDC falls under. But sometimes there are other non-clinical jobs I've seen under Health and Human Services. So you can just search that agency. The Office of Inspector General, which does like investigations into like maybe negligent healthcare. They hire physicians from time to time. So the thing about these jobs is they go quick. And a lot of times they'll have a limit on how many applications they're seeking. So you have to kind of just regularly go and be checking. So if you really want one of these jobs, you might want to put up like a reminder just to check like weekly, because they may have something like only taking the first 100 applications, only taking the first even like 50 applications, or it'll close at a certain time on a certain day, and you may never even see it because they go so quick. Know that this is another thing about government jobs. Sometimes they're posted and you'll apply and you won't hear anything for a long time, months even. So you definitely want to have like some kind of backup plan. Don't think that you're gonna, because you see it and you apply for it, anything's gonna happen fast. The government works on like its own timetable. And also the job description sometimes can be very generic. It can leave you feeling like you don't exactly know what the job is. It doesn't matter, go ahead and apply for it. And then deal with trying to figure out what the job actually is later. Particularly like in CDC, the CDC's like job descriptions for physicians is very generic. And I've gotten like follow-ups for like the job listing I've applied for CDC. And when you get the follow-up, when they're like inviting you to see if you want to apply further, they'll give you more descriptions of the job. So like I've gotten like follow-up requests for that initial application for jobs that involve like HPV vaccines, HIV and AIDS research and all this stuff. And I just didn't feel like they really fit my area of expertise, the follow-ups I got, so I didn't decide to pursue it. So like with CDC jobs, it's just going to be like physician. Do you meet these basic qualifications as a physician? Apply for that, okay? And then after that, if they feel like you meet that basic qualification, you'll get emails when it's time to interview. And if you feel like you qualify or you want to proceed with it, then you just proceed with it. And this is another thing as physicians, just because we're used to being like experts in our area, we feel really uncomfortable applying for something if we feel like we don't know everything about it. But a lot of jobs, it's not like you couldn't learn it. So don't feel like you can't go into an interview process, kind of reading up on the topic a little bit and then going into it and really trying to understand if what the job entails is something that you could kind of learn on the job, because many of these government jobs will be willing to kind of train you in the software or, the area that you need to know or kind of get caught up to speed. So don't be discouraged by whatever the job description says for these government jobs. To me, the benefit, I think, of working for like particularly like federal government job is definitely going to be the benefits. Like nothing has compared to the federal benefits I had. The insurance was amazing. Just the time off, because you accrue personal time, which they call it annual leave. You accrue sick time, and then you have also all these federal holidays that you get off. So you can just really be accumulating like a lot of time off, and that's just really nice. My job I had in the VA, because it was a clinical job, I think for psychiatry, I think it actually paid pretty well. Comparatively, of course, you're not going to make as much you're going to make like in a private setting, but I think the pay was pretty competitive for all the time off I had and for the great benefits that I had. I think it wasn't necessarily a bad deal. As far as like an overall package for like a clinical position. The non-clinical positions tend to pay less, but you have to kind of weigh that. I mean, if you think about sometimes in clinical roles, how much extra work you're doing that you don't get paid for compared to some of these clinical jobs when you may really actually only be working like 8 to 5, it can kind of even out. So don't discount a government job. So again, I'll include the link and a list of some of the names of these agencies. Again, when you're on USA Jobs and you're search for medical officer, medical director, and if you can, the agency, it'll make it actually more likely that you'll find the non-clinical position.